Hi, I'm your host, Marsha Florence for Just Ask Podcast Live. Good afternoon, ladies and gentlemen, and thank you for joining me. You know, it's been a minute since I've seen you all because we've been out in the field trying to gather up as much resources as possible for you because we know there's the season change, resources change, and some of them, they don't go away, they get better and become more available to you. So today we're doing our quarterly session with our none other publishes, Pat Rencher of the Urban Aging News, and we're going to go over our sections of her monthly quarterly paper so that you who are watching the show or listening will get a chance to know what resources are currently available in your community and at large. So without further ado, I got to go to Pat Rencher. Hey, Pat Rencher.
Hi, how are you?
I'm good. How are you?
Good. Glad to be here.
Now, Pat, you know what time it is. It's our quarterly time to get together and do what we do. So I wanted to make sure that the viewers get a chance to sit in on our usual quarter session. So let me ask you, is this the fall season session? What session is this?
This is the fall issue, and it's also the annual caregiver issue.
Okay.
So it's targeting caregivers, while most of the other issues have an array of aging topics.
And one thing about the caregiver issue, if you haven't been a caregiver yet, ladies and gentlemen, you'll be enlightened to know that this information is steadily growing. So it's nothing that goes away. It's everybody's family that you eventually be a caregiver, whether it's a parent or a child or a sibling or something or other.
Or as Rosalind Carter says, everybody will either be a caregiver or need a caregiver.
Ooh, okay. Well, I wanted to go to that beautiful cover page of yours first and foremost, which I think is very, very nice. The Many Faces of Caregivers. So that's definitely the title of this show today. And so tell us a little bit about the cover shot.
Well, that's just to give folks a reference of who serves as caregivers. Typically, it's females, the adult child, female. But there's also lots of men who are caregiving as well. So it spans the gamut.
I mean, I see the photo with 3 or 4 gentlemen in there. So, most people think that that's a woman's job to be a caregiver, but it's not.
Right. It's whoever is, let's say, I don't want to say whoever is available. I want to say whoever steps up.
Right.
And we have found that there are many men who, for whatever reason, maybe the other siblings don't want to help, or maybe this has something to do with the relationship with the parents. There's all kinds of reasons, but men step up too.
And if you notice, the men who are stepping up to take care of their moms, that is something in itself. I mean, regardless if it's a male or female, but me and my thoughts, a man taking care of his mom, that's got to be a very unique situation when it comes to the care of a woman. Just knowing that that's a woman and what you have to do or what you need to do. Do you call in some extra hands? Can you get any extra hands to help you because it's a female? But I learned from my own situation when I had to help take care of my father. So the same feelings that a man would have in reference to, taking care of his mom, believe me, it's the same thing when you take care of your dad.
Oh, absolutely. Yeah. Yeah. And I laugh when you say that because it was an incident in particular. My father was so busy trying to hide his privates that he was about to fall. And I said, Daddy, I don't want to see it either. So
yes. And to be honest, I'm hoping that those who watch the show get to understand that it's your parent. You know it's your parent, and you have to do what you have to do to help the parent. That one time shock or whatever for both of you, that's it. I mean, throw that out your mind and do what you have to do, because that's the focal point, is that I have to go in here and help my parent take a bath, take a shower, change their diaper, whatever it is. Get over that initial shock and let's get this work done. Okay.
Exactly.
Right.
Exactly.
So, if you're gonna take care of a newborn baby, what they say, once a child, twice a man, once a child. Okay, so just get over that. But my hat is off to the men who step up to do the right thing to take care of their parents, period, and most definitely when they have to take care of their mom. I'm really, really proud of men. So I want to get into the paper, Pat, and that like I said, that lovely cover was something to see, and we have to bring that back up again. But let's start off with our first page here. So we got Patient Advocate Guide, Healthcare Consumers. What is that?
So think of an individual like me. I'm considered a solo ager. I have no children and no spouse. And if I were to become incapacitated or just, I got a bad diagnosis, I could use a patient advocate, someone that would go to doctor's appointments with me, ask and get answers to relevant questions. And this is some of the hospitals are providing patient advocates, and then there's some national organizations that are providing patient
Okay.
advocates. So they're specifically for people who just need a helping hand.
A lot of people don't realize that my mother used to always say that even when I was a little girl. She said, don't ever just drop your loved ones off at the hospital and leave. Go in there with them, find out what's going on, what their condition is, and oversee them, because they may not be able to speak for themselves for whatever reason. And that's just part of it. But now we're at a point, it's not just dropping off at the hospital, it's the clinic. You can take a person to the clinic or the doctor's office, and you sit in the lobby while they go in the room, but they're of an elderly nature, or not even an elderly nature, may have some cognitive issues and can't remember what the doctor is saying.
Absolutely.
So
Yeah.
one of the questions I have, though, if you're going to be a person that assists in advocating for a person, do you have to have legal power of attorney, medical power of
Well,
attorney?
I think in some cases you do not. It's probably best if you do. But when you call these national organizations, these patient advocates have been through a series of training. And so if there's some kind of arrangement that the patient can make with the advocate, it could be power of attorney. But they can explain to you
Okay. Because I think it's
what's
more to
needed.
it. But I would like to say for our audience that, ladies and gentlemen, if you are a person that's caring for your loved one and you have to go to the doctor with them, see if you can get something in writing. If your parent or somebody will write, can sign a note or write a note and say, my son or my daughter is with me to speak in my behalf. That way, it takes some of the sting out of it. Even if you had to get it notarized or something, because a lot of times, the doctors don't mind, but you need to have something on record to help you make sure that you can help make the decisions for that loved one.
Yes.
Yeah,
Yes.
that's me. That's me. So what do we have here, Pat? We've got, this is
Well, we
PACE.
always want to promote PACE. PACE
Okay.
stands for Program of All-Inclusive Care for the Elderly.
Mm-hmm.
And the PACE program just added its seventh center in Southeast Michigan. They added, now we have 3 sites in Detroit. And so it's a program that, first of all, you need to be nursing home eligible, but you can stay at your home. You receive all your
Mm-hmm.
services at home. So it targets people who are on Medicaid and Medicare, even though they do have a private pay, but it allows you to get all your services in one place. You go to the adult day center activities, or for your
Mm-hmm.
medical help, your physical therapy, your dental, all of that.
Okay.
So we just wanted to highlight this again because so many people are concerned. They may not have the money to put their family members into assisted living, but
Mm-hmm.
this is probably the next best thing where you can stay at home and receive your services at
Yeah,
home.
because I saw it said wraparound program, so usually that's what it is. And in a wraparound program, depending on what services it is, but you got your social worker, you got your case managers, you got your whole team to help you, make that situation better for a person. And I really would hope that people tune into Just Ask to find the various resources that they can utilize for themselves or their loved ones, because this is a road that everybody goes down. This is not a one-way road where, okay, well, that's my mom, that's my dad. No, it's going to be you too, dear. Okay, so it may not be your turn just yet, but it's a road that if it gets better, it gets better. If it doesn't get better, what do you do?
Mm-hmm.
So, and I was just speaking to someone, I think it was yesterday, we were talking about when caregivers go to the homes, you got these home health care aides and stuff, they come to the home, and some people won't open the door. They say, oh, I got to clean up, so when I clean up, I'll let them come when I clean up. If you haven't cleaned up in 2 months, 3 months, 6 months, what difference does it make? Open the door and let these people do their job. They're not there to judge you and say, oh my God, they don't have anything to do with your house. They already know, any given circumstances, they're prepared for it.
Right.
So I would hope people start paying more attention to the resources and get the help instead of worried about the pile up of the paper or the cat and the dog poop, whatever. Just get your services, people. So what do we have here, Pat? Review Medicare plan during open enrollment. That old famous open enrollment.
Yeah, it's upon us. October 7th, is it? Through October 15th through December 7th. And just a reminder to everyone, review your current plan.
Mm-hmm.
I'm going to review mine because there were some things that people told me they had, and I'm like, I want that too. So, and insurance companies change. They change the medicines that they offer, your prescription. So you want to make sure that for the upcoming year, that if you're especially if you're pleased with your current healthcare provider, that you look and see if they're still providing the same services, and particularly they're still covering medicine. And so there's two. We talk about the kinds of things you want to review,
Mm-hmm.
and also if you need any help, an agency that will help with reviewing your current plan. There's
Yep.
the number. DAAA will
Mm-hmm. Mm-hmm.
will help you, assist you with reviewing your current healthcare plan.
Okay. Okay, that's good. That is real good information to know. Okay, but that because open enrollment is a serious situation. Every year around the same time, you see so many of the agents just climbing all over each other trying to get enough recruits in. And I think when you fix your or get your insurances together, ladies and gentlemen, my key thing is ask them what you're eligible for. Don't just say, okay, well, you're gonna give me a card so I can get me some groceries every month. You guys got. I mean, some simple stuff like the card with the $50 is good. The grocery
Mhm.
attachment is good, but I want transportation to and from my appointments if I can get that. I want vision care, dental care, ear care. I want the stuff that I know that it's hard for me to get, period. And how often can I use it before I have to come out of my pocket? That's what my whole concern is. I'm not into I understand we want the food card. I understand we want, the Kroger card and all that stuff and the $50. But come on, give me some stuff that I'm struggling with when I need a new pair of glasses. Can I get the glasses? And if I have to pay a copay, how much is it? Something like that. So I'm hoping that
Mhm.
open enrollment this year for people that they ask more questions about what are some of the available services that connects them to the card, and what is Part A, Part B, Part C, Part D. So get all those parts together to make sure you got it, not just your prescription coverage. So I'm a stickler like that, Pat. I can't help it. I just, I feel like, hey, the more the merrier. So what we got here, Ladybird Deeds, leaving real estate to loved ones. Oh my
Yeah.
goodness.
Oh yeah, we run this story at least once a year because so many people don't have proper documentation so that they won't end up in probate court. Um, we did a Ladybird deed, my sister and I, my parents, And when they passed on, there was no problem. The property went immediately to the two of us. It's seamless. So this is to avoid family arguments, um, trips to probate.
Okay.
Ladybird Deed.
Yeah, I got to ask that famous question. So, I've never heard of Ladybird, but I just want to ask you. So, you got siblings, okay, the parents are gone and the house is left over. Now, if it's more than one kid, two, three, four kids, you got two or three saying, yeah, let's go ahead and sell this house. You got one on the out saying no. So, doesn't that put everything to a
That's
halt?
your family business. And I laugh because on the deed, they may at least leave it to Pat, Joy, and Marcia. And then after that, there's, the legal, there's no more concern about how and what you do with the property. That has to be settled among yourselves.
Mm-hmm.
Unless maybe in your parents' will or whatever, they may stipulate that two of the three may decide what to do with the property upon our passing, or something like that.
Well, let's just hope that that's what the agreement would be. I can't see that, but okay, because if somebody dies suddenly, we don't have that kind of that kind of piece of paper laying around somewhere. So hopefully, I think that really I would like to see parents when their children become mid-range adults, like 18 to 20 something. Let's have that conversation about when mom and
I'd like to see that too, Marcia. People just
and it
aren't
doesn't
doing.
matter which family, what level of income the family is. I just like for somebody to say, let's have this mid-range conversation with our children so that they will be better educated on what we want them to have or what we want them to do if something should happen to us. Even if one parent passes on, and I heard a lady say one time, well, a daughter of a parent of a couple, the mother passed on and the father was still living, and she said, my dad better not bring another woman to my mom's house. Now, when both parents are living, it's the family house. It's our house. It's the parents' house. When one family passed on, my dad better not bring another woman to my mom's house. I'm thinking to myself, well, first of all, they acquired this together. So if he had to pass, what was you gonna say? My mom better not bring another man to my dad's house. I mean, come on. But we don't sit with our children long enough and well enough to tell them that if something happens to one or the other, this is what we want. This is what we want. And even if you're a single person and you've got nieces and nephews, I think the same thing should happen. I mean, I prepared my nephew. I did. I prepared mine. So I don't know if he's really listening, but if something happened, I bet he
I
would.
agree with you. And if you're many people just aren't going to do it that early enough in the game. But at the very least, when there is a diagnosis, when someone has become sick, then let's have that conversation. What do we want to do with the property? Who gets it, and so forth. And so that's what we preach all the time.
Well,
That's why we always have legal articles in the paper.
Something, even if it's in the Bible, just put it in the Bible, okay? That's why I believe in the Bible. All right, so what do we have here? Prepare now in case of a power outage. Now, you know what? I faced this situation, so I was glad that you, wanted to have this story in here. And this was one of the, by the executive director, Monica Williams from New York and Michigan Solutions Journalism Collaborative, which we are a part of, Pat. So it was good to see this article here.
We are our good friend Monica, and she was right. This is a perfect. Monica provides a listing of the kinds of things that you should consider or include if you're caring for someone else. We've had more power outages here lately in Michigan than we've ever had. And so it makes sense to prepare a power outage plan and a power outage suitcase. And that's exactly what she's suggesting in this piece.
And I
And
see
gives you the items.
I'm looking at that. I'm like, she's got a battery powered radio, an extra battery, cell phone, car charger, in case power failure, first aid kit, flashlight, with extra wide beam. I mean, she's got it down to a pack. A few things is missing, Monica, but it's overall, this is a wonderful idea. And you know what? That's just like for anybody. You're supposed to have an emergency plan, and we don't. We don't. We really don't. But when it comes to a power outage or some type of act of nature, and we have to move our loved ones who have disabilities, somewhere else, what's Plan B? I mean, my sister that I care for, she had COPD, so chronic pulmonary disease, and she was on oxygen. It was, I mean, Pat, that was a scramble and a half to figure out where we were going to go. So luckily we did have another sibling, and I would call her and I say, hey, we need to come over there. And we had extra equipment for my sister. So I would actually pack my car, haul the equipment to my other sister's house so that we can take care of our sister. I mean, it was just, it was just unreal. But to me, I had that Plan B always scheduled in my mind because, yes, in Michigan, we did have some serious tornadoes and floods, or not floods, but floods and some tornadoes. They was like, are you kidding me? It's out on the one side of the street, not out on the other side of the street. Stuff like that. So I thank Monica for that article. That was a wonderful article. And I would hope that people who are caregiving for individuals, especially one parents or whatever, you do plan something. Just kind of like, put some things away and say, in case we got to go, we'll be ready. And it don't even have to be a suitcase. It just needs to be, the items like she said, flashlight, some water and stuff, changing clothes, whatever. But all that stuff is very important when we do have those power outages and we don't have a plan or don't know who can take us in. If there's nearby hotels or anything like that, it may not be that. Yeah, so we have to thank her for that article. So, okay, now we have here a National Caregiver Support Portal. Do we really, Pat? It's a portal?
Yeah, so it's called True Alta, and it's a training program you can do online at your own pace, at your own convenience. And, for caregivers, all the experts recommend that you belong to a support group, that you get training on anything from transferring loved ones from bed to wheelchair to falls prevention, all that kind of stuff. So now it's nice and neatly packaged in this True Alta program. So DAAA, Detroit Area Agency on Aging, actually can provide caregivers with membership. There's no cost. But if you were to call DAAA and ask for the caregiver coordinators, they can connect you. And people have gotten some really good results. I mean, some people who just can't go any place. Maybe they can't go to an in-person meeting for support. But this is another way to have support, to get support on your caregiving journey, because it's very isolating, as you know.
Oh, yeah.
And so you need, even that support group online helps you to connect with people who are in the same boat in caregiving.
I'm going to have to check that out. That's good. Okay, so I know this is how carers can schedule self-care. So this was the other part of that page or something?
Correct. Yeah. Okay. That's the last piece of that.
Okay. Yeah. So ladies and gentlemen, if you didn't see that, okay, and then there's I see a chapter phone number down here too. So the Alzheimer's Association of Michigan chapter, their phone number's down here, 248-351-02.
That's for the caregiver self-care. We are always promoting that. It's how can you take care of someone else without self-care? So it's just some reminders or some tips on the kinds of things you should consider.
I see you got the Hannon Center down here, Hannon Center Daybreak program. I talk about that program all the time. We have to get Vincent Tilford back over here because that's a good program to educate people about. And you have Henry Ford Healthcare program. Okay, some good resources here. Very good resources. Okay, so we're going to go to the news brief, Pat. There's a couple of things in here in the news brief you want to talk about.
A couple of things.
Well, I actually like the respite piece myself.
Okay. You know what? I can't see it.
Oh, okay. Well, I can tell you the respite.
You tell me and I'll elaborate.
Yeah, the Hannon Center offers an affordable adult daycare program for dementia patients. that gives caregivers a needed option. That's right. So basically, what I wanted to say about that was that if you need a day off, or not a day off, but if you need to go out for a few hours, you can actually schedule an appointment with Hannon Center to have your loved one there for a few hours so that you can run to the doctor, grocery, and stuff like that.
Yes, basically. So respite gives the caregiver some rest or an opportunity to go shopping or to go to work. So the Hannon Center's Daybreak program has arrangement with the um, Alzheimer's Association where they will give you scholarships to pay for Hannon Center Adult Day Center.
Okay. Okay. That's
So
cool.
there's two programs. There's one called Team Susie that will provide scholarships, and that's in the earlier part of the magazine. But both of those, Team Susie and the Alzheimer's Association, provide scholarships so that your loved one can attend the Adult Day Center, which is
All
in
right.
Midtown.
All right. Well, we're going to run through these last 3 or 4 pages because I'm getting close to my time. But what do we have here, Pat?
Just a reminder that even though your loved ones may be in a nursing home, you're still caregiving. It's just, it takes on a different form, but these are just some reminders, some things that are important to know if your loved one is in a nursing
What
home.
to know about nursing homes? Okay, I definitely. You know what, Pat? You got to come back and we had to go over that because a lot of people need to know more than that. But yeah, we wouldn't run out of time. Hey there, ladies and gentlemen. There's Just Ask, so you can always click on to us on PBS Channel 56 at 5:30 a.m. or catch us on your local cable station. And if you missed that, just give us a call on 1-800-323-5336. All right, Pat. So now this one is the last page. Tell me about in 2 minutes, Pat. What about this page? I won't lose you.
Yeah, so everybody who Wayne County residents are entitled to free services, either their caregiver or the care recipient. Um, Elder Law and Advocacy Center can help you with your important documents, drafting your wills and power of attorney, and some of the other important documents
Okay.
at no
Okay.
cost.
Well, Pat, I hate to rush. I mean, I was taking my time because with some good information here. So when I see you in our next quarterly meeting, it'll be
I'll see you at your Fun Fest.
Thank you. Okay, we'll talk about those as they come. All right. So thank you. Hold on for me 1 second, Pat. Well, ladies and gentlemen, I hate to run because my time is running out, but I'm your host, Marsh Florence, with Just Ask. So please tune in to our podcast live or watch us when we do a show in the studio. I'm your host, Marsha Florence, for Just Ask. And what do I always say? If you know a person with a disability or if you just got a general question, don't be afraid to ask. Just ask. See you next time.